Hey there, everyone. Today we're delving into Bob Lebow's compelling book titled Care Meltdown, Confronting the Myths and Fixing Our Failing System. This is not your typical book. It's a thorough, fearless, and insightful exploration of the struggles, obstinate mistakes, and profound issues within the American healthcare system. Imagine this. You're a patient, fearing that your insurance might be slashed or terminated, pushing you into becoming what Lebow calls a healthcare beggar. Millions of Americans are already in that grim position. They're either without coverage or struggling under the weight of sky-high premiums and out-of-pocket costs. Take the countless examples of families fearing their insurer might revoke their care, leaving them precariously perched. This isn't just an abstract situation. It's a lived reality millions grapple with every day. Despite racking up nearly double the expenditure per person on healthcare than any other nation worldwide, the United States sits uncomfortably at the bottom when it comes to health metrics. Yes, you read that right. We're not leading, we're trailing. Our lifespan is shorter, our infant mortality rates higher, and sometimes our health measures are even deemed abysmal. Alarmingly, debt from healthcare is the second highest cause of personal bankruptcy. Can you really blame folks for questioning, where are we going wrong? Self-interest, not community commitment, has been the driving force behind America's healthcare system. Now, let me paint a clearer picture. Imagine you're a health insurer. Your business model is centered not around patient care, but on slashing costs, and that often translates to cherry-picking the healthiest individuals into your plan while excluding those needing more extensive treatment. That's akin to saying, hey, come play if you can afford your injury, stay home otherwise. That's the crux of the issue. Regrettably, comprehensive solutions like universal health care have been shelved by powerful lobbies claiming such plans could lead to socialized medicine or are simply too costly. But hold up. Did you know countries like Canada manage to cover everyone without burdensome debt? Meanwhile, our fragmented and profit-driven system pushes millions into penury. Let's delve into the harrowing reality of what life is like for a fraction of Americans. We have tales of uninsured folk, desperate for a diagnosis or treatment, relegated to seeing us emergency rooms, a place of last resort that costs, yeah, you guessed it, exorbitantly. Delayed care is often a safer bet. A middle-class American, let's name her Gwen, passes on getting checked because she owes $6 for an earlier visit. Yet, when she finally slogs through to the clinic with a high fever, her issue balloons into a severe intestinal crisis. Delayed care sounds harmless, right? Nope. Extra costs, complications, and worse, lives shortened. Many think universal health care as a noble pipe dream. But this is not just a pipe dream, it's a fundamental necessity. Canada's system hints at what's possible, shrugged off by myths born out of misinformation and political alibis. A country where anyone can see any doctor or walk into any hospital, free from the fear of getting into debt due to health care. Doesn't that sound like the America we envision? The American discourse on healthcare is a battle between myths and reality. The alpha myth, that we have the best healthcare in the world, perpetuated by vested interests, shields healthcare corporations. Imagine this misconception swirling in the public mind, shrouded by the might of advertising. The media perpetuates this notion to an unconscious audience, thereby fortifying a system that benefits a few at the expense of many. Think about the bile source, people who debunk the misinformation and truths about America's healthcare. It's not just about snatching myths off the table, it's about re-educating a population long left in the dark. Guys like Bob Lebow are persistence campaigners, fighting to enlighten Americans about the radical, compassionate changes they need to demand from their politicians and legislative bodies. Imagine an America where everyone, not just the well-insured, has equal access to health care. Doesn't that make you stop and say, wait a minute, We've been hoodwinked? Here's the compelling call to action that the book drives home. Cooperation, not competition, is what makes healthcare affordable, especially midstream in the healthcare cycle. Lebow illuminates why the educational ethos should put the patient first. Healthcare as a sector needs to respond holistically, beyond the profit margins, and into the present and future betterment of public health. Lebow's approach is one of hard-hitting facts mingled with sober analysis peppered by anecdotal evidence. Consider the stories behind Alabama Mater, squandered by delayed care, and the Herculean demands some patients undergo to afford care. Each chapter is an open salvo against America's skewed healthcare model, but it is also a beacon of hope that a better, more compassionate health system lies within our reach. In a nutshell, Lebow's message couldn't be more vital. We need to stop ignoring the realities of our failing system. We need to abolish the thorny myths that have shielded inequitous practices. We are all part of the same system, and we need to voice our collective will for a healthcare system that underscores justice, equity, and the intrinsic human right to dignity. So, as we conclude this session, let's take a moment to reflect. Imagine a world where healthcare is not just doable, but a vibrant reality prioritizing everyone. If you can dream it, you can achieve it. Let's all rise for the cause of healthcare for all. Visit brightlearn.ai for more fascinating videos like this one, and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.